So on the federal level, if you declare something as a public health crisis, that gives you like more access to funding. But as something you've mentioned before, it's really hard to instate something like directly on a national level, especially with things like gun control. So I do really see that value in starting at the state level and then with data showing how effective it is, because policymakers love data. And if they see, things, and that's something us early career researchers can produce, right? And if they see data points really indicating that, the methods that we're suggesting can make a change, then we can move to the national level.
Welcome to the official podcast of the Journal of Science Policy and Governance. In this podcast, students and early career researchers share more about their publication in the journal. Join us weekly to hear from the next generation of STEM leaders as we elevate their voices in science, technology, and innovation policy. Welcome, and thank you for joining us for this episode of SciPol SoundBites, a podcast of the Journal of Science Policy and Governance. I'm Adriana Bankston, JSPG's Chief Outreach Officer and your host for this podcast. Today, we continue with episodes from the joint issue between JSPG and the National Science Policy Network, resulting from the 2020 Policy Memo Competition. Authors we are interviewing today are discussing important policy topics related to healthcare and schools at the state level. So let's talk a little bit about each publication. So we'll start with Thomas Pospiech. Tom is a fifth-year chemical biology PhD candidate at the University of Michigan in the Southwards Lab, completing his dissertation research at UCSF. He is also the outgoing treasurer for the Science Policy Group at UCSF. He co-leads the Clean Hand Sanitizer Mutual Aid Project and serves as the co-ambassador for the Alzheimer's Congressional Team to Speaker Pelosi as a member of the Alzheimer's Association. The memo published in JSPG by Thomas and his co-authors is entitled Medical Necessity Standards for Mental Health Parity in California. Tom, can you tell us a little more about the policy issues that your memo seeks to address?
That's hi. Good morning and good afternoon. Thank you for having me on to speak a little bit more about our policy memo that our group wrote here at Science Policy Group at UCSF earlier this year. And so our policy memo seeks to address this disparity that happens when you're seeking physical health treatment versus mental health treatment. So this topic is called mental health parity laws when you're looking at this. And the general idea is that if you're seeking mental health treatment and your insurance provides mental health care coverage, that the level of coverage that the insurance company provides isn't any different should you have a physical ailment of some kind. So if you have like a broken arm or something like that, it's very clear what sort of treatment you're going to get, like broken arm, get a cast. Now it gets a little different with mental health treatment because it's harder to understand what's going on. We learned a lot about what's happening, but it's still one of those things that it's not as clear cut as your arm's broken, you get a cast. And so insurance companies do this thing where they have to determine whether or not the treatment you're seeking for mental health treatment, they also do this for physical health treatment, but for mental health treatment, it's a little bit variable, inconsistent, in terms of making these determinations. Is the care you're seeking medically necessary? But all these companies implement this, they all have to make some type of determination. And so our policy memo seeks to address ways of how do we sort of standardize the definition for what is medically necessary treatment. How are they defining this? How are they determining whether or not to approve or deny your claim? And it's kind of increased transparency in the overall process, as well as give policyholders a chance to really review what their insurance coverage is. I know myself, I'm a little bit unique so I'm still a University of Michigan grad student, but I'm a visiting graduate student at UCSF. So I have spent probably more time than the average person trying to figure out how to use my health insurance coverage out in California than most people have. But that's where we kind of come in with this idea of a cooling off period. It gives you this chance to kind of review what plan you may have just purchased and change it should what you purchased was not what you thought you purchased.
Yeah, thanks. That's really interesting. So I've seen a lot of talk about mental health issues, especially at the academic level. And I think being a trainee, that's one of the things that we don't discuss, and it is very taboo in a sense that, like you said, it's not addressed similarly to a physical ailment. Um, and so I'm curious if I also, from your perspective of the Alzheimer's Association, how do you think this could be addressed, maybe at the academic level versus more broadly within California, and what your memo is getting to? But I'm also curious about the academic side of this.
Yeah, so that's a good question on an academic side. I've put some thought into this. um, I think you hit the nail on the head. There is still a great amount of stigma around this. Um, I do believe, I think it's Nature or Science, I think every year, every other year puts out a study on, they always poll, I don't know, 2,000, 5,000 graduate students asking whether or not they've had some sort of major depressive episode. So that's 2 weeks of being depressed or something like that. And if I recall correctly, the percentage is something on the order of 30 to 50% of graduate students report having some sort of major depressive episode in the past year, which is about, I want to say, twice the rate of what the average citizen in the United States experiences. And I think part of the conversation comes around decreasing the stigma around this. It's still one of those things that most people don't feel very comfortable talking about. I think people in general are probably not super comfortable talking about like a physical ailment that they might have if it's more invisible, so to speak. And so I think part of the conversation is having these conversations. Maybe it just starts with your research advisor. I'm not saying you have to disclose everything to your whole lab group and stuff like that. But it can also be having like these sessions on what sort of resources what sort of resources are available on campus to students is also very important. So that's the other side of this is, in general, those who are seeking mental health treatment are already kind of ashamed of themselves for whatever reason, societal or otherwise. And so it's a little bit more difficult for them to seek treatment to begin with. And then you throw this complex layer of like insurance companies on top of it and a difficult system to navigate. And it just gets harder and harder. And then it's also trying to figure out, is this person accepting new patients? But getting back to the academic level, I think stigma is one. I'll speak from a little bit of personal experience. I don't want to say this is everyone's experience in academia, but I do actively see a therapist. And I know like some things that kind of come up in conversations, I think it's kind of unique to graduate students, but also maybe more so to graduate students in the Bay Area, is you have a lot of different stressors on your life, right? So one of them is, there's not much wiggle room on this one, but it is your stipend. Like it is very difficult if you're not living in student housing to cut it here. And so you're adding a layer of financial stress on this. So if there's something that can be done to help alleviate that financial stress, that can do loads. I'll speak from experience. I moved here. I was living in San Mateo and spending an awful lot of money just to like get to and from to work. And every month I look at my bank statement like, okay, it's more or less at the same amount or even lower than the previous month. And so that doesn't help your mental health. Another thing is just creating a support network. And this is actually something I've been meaning to look a little bit more into. It's just kind of like graduate students who are also going through the same thing. I forget, I think I have her business card here, or maybe it's not her business card. I'm forgetting her name, but she runs PhD Balance. She was out at, I think, UNC Chapel Hill. I apologize if you're listening to this podcast. I am forgetting your name.
Yeah, it's Susanna Harris.
Thank you, thank you.
Yeah.
So she came to campus last year and kind of had, I want to say there's probably like 20 or 30 of us that kind of came to this. It was a closed door session. It was like whatever is said in this room is strictly in this room, sort of thing. But one of the things I've been trying to find, and I just haven't had the time, the story of a graduate student, is to sort of have these support groups, because I think you obviously get support from your cohort, myself being in a slightly different situations, I don't have my cohort. My cohort's back in Michigan. And so it'd be interesting to see if there are sort of like these groups where students who are maybe going through similar experiences can kind of get together and just kind of have like a discussion on somewhat of a regular basis. And I say that because there was at least one colleague I remember sometime last year, I could notice something was off with this person, but once again, because a little bit of the stigma, you don't want to go, hey, you seem kind of depressed. That's not like a really great way to start your conversation. But once we kind of sat down and she opened up kind of freely about it and said, hey, I've been going through the same thing. And it's just nice to know that there's someone else who maybe everyone's experience is maybe slightly different, but there's this commonality of sometimes just feeling alone, depressed, whatever it might be. It's just nice to know that there's, not nice, but that you have other people that you can talk to discuss this, that it's not just you experiencing this. And I think that's one thing that people don't realize is just how prevalent this is in academia. But then when you're going through it yourself, you just really feel like it's just you. And then another aspect on this, and this is maybe another harder implementation, is sometimes the work environment. I do think this is improving, but I do think a fair number of labs kind of support this idea of come into labs 6-7 days a week. You should be thinking about your research 24/7 and stuff, and those sorts of mentality, which is, for some people it works. That's fine. For other people it doesn't, and I think that's something that as academic institutions need to recognize. And I come from a slightly different perspective that I worked for a few years, both in the government and in industry. And so to me, it just boggles my mind that people are working 80 hours a week, or they're working 50, 60 hours a week and then told that they're not working hard enough, that they just need to, if they just came in more and worked more, like their project would be more successful and those sorts of things. So those are some of my thoughts around academic institutions. Maybe not necessarily towards mental health parity, but just having a more open conversation around mental health in academia. And then your second question was like a little bit more broadly, like what can you do at more of a national or state level? Well, maybe I'm slightly biased because I'm with the Alzheimer's Association. If you're interested in that type of work, they have all sorts of congressional teams, state and national level, that you can get involved with if you're interested in Alzheimer's and dementia research. At state level, it really is just kind of getting a little bit more engaged with your policymakers, whether that's going to your state legislature and kind of telling them, hey, this is what's going on. These are some of the things we think should be addressed regarding mental health parity or whatever topic you're interested in, because ultimately they respond to their constituents. So that's an important thing when going and advocating, is that you try to target the districts that you live in. You can reach outside of that as well. But I think overall, it's just sort of calling up your legislators and telling them, hey, thank you for, first off, thank them, of course. Thank them for the work that they're doing, but also bring to attention that what are the current issues and what are some ways to solve them, and kind of bring your unique perspective to this. Because myself, I'm a chemical biologist. Our team that worked on this earlier this year, we were a group of neuroscientists. Someone was finishing up dental school. Another person, their background is in law and so forth. Another person's in, I want to say is clinical psychology, clinical pharmacy. I'm forgetting, sorry, this is Larissa's affiliation, but just sort of having this broad group of people that have all these different backgrounds, but coming in and saying, I'm a scientist, and telling them sort of like, this is where the research is at. This is what we know. This is what would hopefully work to address these issues. And that's a big thing for them, is because most people working in legislatures don't have a great scientific background. So for them, reading the literature is not something that they're going to do probably at all. but B, if they do, they're probably not reading it like super in depth. And then, so it's a lot harder for them to interpret what is, most things that get published, I would say, are fact, but there are like things that need to be tweaked. What things are well established, what things are kind of like experimental and still being decided upon. And that's a little bit harder for a person who's not in a scientific field to kind of parse those things out. Because I feel if you just sit down with a paper in front of you, most people are going to say, oh, this is well established stuff. When really, like, there's maybe little pieces that they're maybe still saying, this is something new. We still need to research it a little bit more to better understand this.
Thank you. Yeah, that's a really thorough answer. So I think for the first part of this with the mental health and academia, I think, yeah, I wanted to get a kind of a trainee perspective on this because I think it's important, but, you know, as you said, it's also in your work, in addition to the mental health issue, there's also the insurance. So that is, you know, complicated, but yeah, I'm glad to hear what your thoughts are for changing this. Great, and then also, yeah, talking about legislators, I think that's important for also early career researchers who are looking to get into policy and how they can bring their expertise to the Hill and also local policy as well. So that's a great point as well. Thank you. So we'll move on. We'll stick with the California theme. We'll move on to Agnes Varghese, who is a fifth-year PhD candidate in the developmental psychology at the University of California, Riverside, and she seeks to translate science in an understandable way to policymakers, content creators, and the general public. She's also the chair of the External Affairs of the UCR Center for Science to Policy, a district science fellow in the Office of Assembly, a member Eloise Rees, and also junior fellow at the UCLA Center for Scholars and Storytellers. The memo published by Agnes and her co-authors in JSPG is entitled Beyond Gun Control, Implementing Mental Health Interventions for the School Shooting Crisis in California. Agnes, can you tell us more about this school shooting crisis and how your memo seeks to address it?
Yeah, so first off, thank you, Adriana and JSPG for having me here to represent some of UC Riverside Center for Science to Policy, their work. And thank you also, Thomas, for being so open about your experience at the intersection of mental health and grad school. And I'm glad we're here together today because our memo is also about mental health. So yeah, to address your question, before the pandemic, when K through 12 students were physically in school, we were seeing a dramatic increase in rates of school shootings in this nation, especially in states like California, who saw something like 166% increase in shootings in the last 10 years alone. And since I and the other students who worked on this piece live in California and work with legislators here, we wanted to really come up with a plan of action to tackle the crisis on the state level and then have it serve as a model for other states, as this is definitely a nationwide issue and we can't afford to lose any more innocent lives because of it. And I think you also mentioned asking about how we hope to address this issue, right? So the school shooting crisis is actually pretty multifaceted. So gun control matters because at the end of the day, people cannot be shot unless perpetrators have access to guns. And we also know that politically, gun control is actually a controversial topic. And those who plan to commit a school shooting could potentially gain access to guns illegally. So we had to think about other measures that also matter in tackling this crisis. And these are measures that could be both effective and that both major parties could potentially support. So where we landed was talking about mandatory social emotional learning programs for K through 12 students. And just to explain that, these are programs where we teach students skills in empathy, anger management, problem solving, and impulse control. And we're really trying to get at the root of some of the issues that students may be dealing with internally so that we can teach them more effective ways to deal with their problems than resorting to gun violence.
Great, thank you. Yeah, that's really insightful. I have to be honest, I didn't know much about gun violence before this, that it seems like it's a very complicated issue. Like you mentioned, there's a lot of facets to this that you wouldn't think about, especially in teaching responsible use, I guess. So maybe some people, I don't know what your opinions are about whether people should have guns or not, but there's certainly a lot of regulation or responsible use, I guess, if you do have one, and how do you teach people to use it or not use it. So I think I want to come back to one thing you mentioned about how, and Thomas also alluded to this, is how some of these things are, you're looking at it within California, but they can be expanded beyond the state level and looking at more national level where this is happening, and as well as in terms of more actionable things. How do you think some of the recommendations that you have could be implemented sort of beyond the memo? You know, what do you see as the next step, and is that something that can be stretched to other states as well?
Yeah, so right now we are sort of in a tough spot because as most students are not physically in school right now, policymakers might not prioritize the need to address the school shooting crisis. But as we've seen with COVID-19, inaction from the beginning leads to far more eventual suffering than any one of us could have imagined. So I'm just really fighting to make that point clear to policymakers. And I'm also adapting a new, maybe more timely angle for policymakers that they might be interested in order to still push forth social emotional learning programs. And what I'm doing is indicating that this measure is also necessary for students to deal with all the emotional trauma associated with the pandemic. So this could include losing your loved ones, financial issues, social isolation, all sorts of things. There was some data that was collected by the Youth Liberty Squad with some K through 12 students within California, and they found that mental health is generally declining during this time in the pandemic. And they also saw that over 50% of students are seeking some sort of some more mental health resources in their lives. And so you know, this is, again, another reason why social emotional learning is important for us to implement. And not only does it, you know, decrease the rates of aggression as it does with school shooting relevant issues, it is tied to positive outcomes across the board for all students. Outcomes including pro-social behaviors increased, better academic achievement. So these programs really help students who might fit the typical school shooter profile. They might fit the people who are undetected as being capable of this sort of act, but then it also just helps increase social emotional well-being for everyone overall for situations like the pandemic where people might be dealing with loads of issues. And about you know, implementing these acts on a more national level. So, you know, California tends to be at the forefront of certain policies. And so hopefully what we do here, if we can come up with a plan that both parties are okay with, which I hope the social emotional learning programs being mandatory they are, hopefully people can use the step-by-step guide of how we do it here. Also look at, you know, how effective it's been and use that as motivation to implement it in their areas as well. Because at the end of the day, kids are very important. They are a very vulnerable population, and we should all care about moving towards their betterment.
Great. Yeah, I think you bring up a really important point as far as California goes and things that are working there in terms of best practices that could be implemented elsewhere. That's really good. Thomas, did you have anything to add to that from your perspective?
Yeah, so it's a little interesting since we kind of play out more of the insurance company angle of this. And so I think a lot of work can be done at state level. I think national level, so that's actually one of the reasons we focused our mental health parity memo on California is basically, if my understanding is correct in all this from our research that we did, is each state kind of runs their insurance companies differently. And so it starts to get like really, I want to say bold, maybe to try to make a whole national recommendation, because I would imagine there would be some states that are for it, that there are definitely some states that would be fairly resistant to this sort of change in policy or the way that these insurance companies make these claim determinations for medical necessity. So I think there's a lot to be done at the state level. I do want to say one thing that was sort of success, so we don't have to work on this recommendation anymore. So it's our recommendation number 1, which was having licensed behavioral health professionals make these medical necessity determinations when reviewing a claim. So currently, that's not the way it needs to be done. They just need to have a medical professional, which their background might be a little bit different for assessing mental health treatment. But what California actually passed, this is like one of the few pieces of legislation that California passed this year, so I think it shows how important mental health is SB 855, which is the first time, I want to say in 21 years, that mental health parity laws have been updated, and basically says any mental health illness or substance use disorder that you seek treatment for, your insurance company has to cover it should they offer mental health treatment, just period. There's no more of this, is it medically necessary? That's out the window, out the door. It's just if you are seeking treatment and your insurance plan covers it, you just get care, like period. So fortunately, recommendation 1, don't have to think on too much. It's kind of nice that this is kind of coming full circle. So we actually started this as a part of, I think it was both a joint grants between NSPN and Research America. We did our Scientists Go to Sacramento. So basically it was sort of a little mini advocacy series and that we did ahead of time. We weren't officially advocating on the Hill in January, but going to our different legislators and saying, mental health parity is important, here's why it's important, and here's sort of the data to kind of back up why you'd want to do these sorts of policy implementations. So the other 2 on the other end of this is in the next month or so. So if you live in the state of California, I encourage you to look at your respective states that you might be in. But in California, this sort of November, December period, all the legislative aides are like dying for like what's their legislation going to be for the next year. And so we're planning to send out emails again to the same people we met with at the start of this year and say, hey, thank you for voting on this bill, like passed and stuff like that. But also here are like some other things you might want to do. So some things that have been addressed are this cooling off period that we had mentioned, as well as, I'm missing our middle, it was the more the transparency. So I was trying to disincentivize financial self-interest of the insurance companies when they're making these claim determinations, because they can use the cost of the care to deny a claim if that comes into play. So there are 2 things that still are out there that exist that kind of need to be addressed, at least at state level. National level, I'm not trying to say it's all doom and gloom. Certain things can get there. I don't think we've met that. I'm trying at the loss for the words at the moment. I don't want to say breaking point, but critical mass. That's the word I'm looking for. We haven't reached like critical mass of all these states saying we need to do this, and to kind of hit that critical mass, it's kind of hard to move the conversation at a national level. But it's not to say it can't be done. So currently, what's trying to be enacted and enforced is the Mental Health Parity and Addiction Equity Act, which was passed in 2008. So there's been a lot of efforts, I think, by the Kennedy Forum kind of going through and assessing how our state's looking at this. Then that's the other thing too, is if you're not in California, so part of our recommendations actually came from my home state, which is Illinois, was one of the few states in the past 2 years. So the Kennedy Forum puts out a report card for mental health parity, and Illinois was the only state to receive 100 out of 100 on this. And then maybe 2 other states passed, and then all other states failed, including California. And so I also make the recommendation, it's sort of what drives the national conversation is kind of what states are doing at their level, because it's kind of like we're the first test of, is this a good idea or a bad idea? And if it's a good idea, maybe it starts to gain traction in other states and it starts to gain this conversation at a national level.
Thank you. I appreciate that. Yeah, and thank you for making the point of the impact that you can make at the state level. We definitely shouldn't discount that. I also like that you mentioned different ways to get involved in advocacy. I think that's useful for our listeners too, especially early career scientists who are looking to do this. And you seem to have a lot of experience with this, so that's helpful advice. and also how you're looking to address this from a legislative standpoint, because that's one of the things I wanted to ask about. Who are the stakeholders in these issues, and who are sort of the decision makers who can actually move the needle on this, right? So in your case, it's obviously a lot of it is related to insurance companies. Your sort of the way that you're looking at it is from a legislative standpoint. So I want to ask Agnes the same question, is from your gun control issue, who would you address this to, who can actually make a change in this recommendations that you have?
Yeah, so in terms of stakeholders, I feel like generally we're all stakeholders in this issue because either we've been directly affected by a school shooting, or we know someone who has, or we've watched the media coverage of it and feel deeply saddened by it. And so hopefully everyone has a stake in wanting to decrease school shootings, especially right now when people are not physically in school. Maybe we can work harder towards making sure that when students do re-arrive there, that the rates are decreased. But yeah, in terms of talking to policymakers and such, any of the policymakers, like if you look at what their big pushes are through their websites or whatever other content that they put out, those individuals who are really interested in human services issues and children's issues and education issues, all sorts of things like that, really making a push to those sorts of policymakers about the importance of instating this. And I'm actually working in an assembly member's office right now, as you mentioned before, and I was laughing when Thomas was talking about how this is the time to push for those bills, because the office gave us a form, like a legislative proposal request form. And I thought it was so cool that I'm finally like in a place where I can fill out a form and say like, hey, this bill is important, and somebody will actually read it, right? Because if we're just someone coming from the outside, we don't know who's going to look at what. But like when you're a scientist in the policymaker's office, you potentially get a little bit more credibility for them to look at things.
Yeah, that makes sense. And that's really nice that you're able to make that impact. I think also when we're starting out and as early career researchers, having these opportunities to make this impact is really nice. So I'm happy to hear that you have that opportunity. So
actually,
go ahead.
I have a question for Agnes, if you don't mind me interrupting.
Yeah.
So my question was, I think at the national level, I think there's always this broad idea of making, I don't want to say it's gun control, but I think it's like gun deaths to make it a public health issue. How does that differ at the state level? Can like California say, hey, we're going to study like gun deaths as more of a public health issue? Because I know that's been kind of maybe a barrier, maybe not a barrier. I'm not as familiar on all the nuances, but I know that's sort of like the push is like, study it as kind of like you do other diseases and try to figure out what's the recommendation to just prevent this from happening. So I don't know if there's a difference between thinking this national versus maybe at California state level.
Yeah, so when we look at the national level, I think there was a freeze on funding for looking at these sorts of issues for several years. And I believe it was last year they reinstated, I want to say something like $25 million to look into these issues again. So on the federal level, if you declare something as a public health crisis, that gives you like more access to funding. But as something you've mentioned before, it's really hard to instate something like directly on a national level, especially with things like gun control. So I do really see that value in starting at the state level and then with data showing how effective it is, because policymakers love data. And if they see, things, and that's something us early career researchers can produce, right? And if they see data points really indicating that the methods that we're suggesting can make a change, then we can move to the national level. Yeah, I mean, it would be great if we could do things right off the bat on a national level. It just, I don't know, for this country, sometimes it just seems too big for people actually to be able to do that.
Yeah, thanks for answering that. And I like this theme that is coming up here also again and again about what early career researchers can do and how they can make an impact. It's really great to see that you both are doing that too. So just to wrap up along those lines, do you have any advice for listeners who are looking to publish in JSPG? If you want to comment on the process or anything about the journal?
Yeah, sure. So in terms of publishing for JSPG, one thing you should definitely look at is the other policy memos that are out there, especially the ones that have won policy memo competitions, because maybe their structures are something that we should think about following. Another thing is making sure that we are communicating our science in a way that is understandable to the general public. So whatever jargon you have in your head, try to condense that down to something that policymakers who are out of your area of expertise will be able to understand. And also have multiple people look at your work. It's just like with us producing other scientific papers. It's a headache when we see all of those edits, but at the end of the day, they really do push our pieces quality forward.
Yeah, I definitely agree on that editing comment. I lead, the past years I've had the fortunate opportunity to lead a advocacy workshop at the LGBTQIA plus health forum here at UCSF. And one of the comments I said is make sure you get an editor or editors who is not afraid to tell you the truth. Like, we don't need anyone to like try to cushion your feelings. Like, get someone who's gonna rip it to pieces if you are like really writing horribly and stuff. So I definitely agree, you gotta have that great editing team. The only thing I think I would add to Agnes's comment is, and I think obviously you have multiple authors, is I really want to say like there's sort of this, I don't want to say strength in numbers, but like strength in numbers getting like a lot of different ideas out there. So I think we started our memo with a certain set of recommendations, and as we kind of like sat there and discussed, and as that's the 6 of us discussed, kind of came up with different ideas. That's actually, I think, one of the ideas came from, for the cooling off period, was this little funny story on my end. I just really wanted a vacation, was what it was, but it, you know, you get those timeshare things. And so they were like pushing for you to do the timeshare, and then eventually I said yes, but I knew there's a clause in there that says like within 5 days you can actually reverse the purchase of a timeshare sort of thing. So that's how the idea of the cooling off period came through, was we're kind of these discussions like, what are things might we want to do beyond what we were saying at the start of this year? So that's where the cooling off period came from. And then Neil brought in the perspective of I think he knew a little bit more about the different cases, obviously being a lawyer, of how there's this bit of financial self-interest that insurance companies have. So his idea of how do we try to take apart the financial self-interest from the whether or not you get covered for your mental health treatment. So I would just say, yeah, have a group of people who are passionate about this, whether it's they want to be your editing team or if they want to be your idea team or both. But I do think there's a lot to be said for having a lot of hard, dedicated people working to solving these mental health issues, but any issue.
Can I add to that? So just to this point, working with a group of people is great, especially if we are interdisciplinary, right? So school shooting crisis, you immediately think this is mental health psychologists, right? But scientists all over can have a stake in this issue because, like I said before, it affects everybody in some way. And just seeing the perspective when I was working on this with others, the perspective that engineers brought to this, that individuals who are studying business brought to this, that neuroscience folks brought to this. That was really great. And also just generally in the writing process, sometimes I'll get stuck on a thought, but other people will, continue writing even if they get stuck on something. And so just having that back and forth was great in order to make sure this actually got produced.
Thank you both. That's really helpful, and it's nice to hear these stories behind the scenes and how you produced the memo. That's really nice. Thanks. Okay, so with that, thank you, Thomas and Agnes, for joining us today, and thanks everyone for listening. You can find this episode and others like it on JSPG's YouTube channel and on SoundCloud. And that's it for this week on SciPol SoundBites, the podcast of the Journal of Science Policy and Governance.
Thank you for having us.
Yeah, thank you.
Thank you. If you enjoyed this episode, subscribe to our podcast on YouTube and SoundCloud. You can also follow us on Twitter, Facebook, and Instagram at SciPol Journal.